Hey guys, thanks for tuning in. Happy Thursday. So I'm Dr. Allison. I'm a small animal veterinarian, and I own a practice in Fort Lauderdale, and I'm with Forever Freckled.
And
Go ahead.
And I'm Marney Prince. I'm a pet nutrition specialist. I love to incorporate traditional Chinese food therapy into Western natural nutrition, and built a company based on it.
Yeah, and we love working together. It's a good combination of Western medicine veterinarian and nutrition specialist that specializes in Eastern therapy, which is a really cool combination. So today we're actually here talking about pet food allergies. It's actually quite common. I see it in my animal hospital, and it's a little bit hard of a diagnosis to make because it can kind of show or present itself in a lot of different ways that look or mimic like other types of allergies. But it is something that I commonly see and I commonly diagnose and treat. And I thought from a veterinarian perspective, it would be a really cool conversation to talk about pet food allergies. And Marney, coming from the pet nutrition specialist in Eastern therapy medicine, I thought it would be really neat to hear Marney's perspective. Marney, are you seeing it a lot in your store and consultations that you work with your clients?
Well, absolutely. Allergies are on the rise, intolerances, and just confusion over what to feed your pet because nothing seems to sit right. And there's a lot of responses that are adverse and that people aren't comfortable with, and the dogs aren't comfortable with. So yes, we see it all the time, and it's a really fun one to help people out because the animals get so much relief. I mean, it changes their lives and it improves it so much with just changing a diet. So,
once you get them on that proper diet, it really does make a remarkable difference. So I wanted to kind of talk today really dive into what is a pet food allergy and what are the common clinical signs that I see. What do you see, Marney? And how we treat it, how we diagnose it, and all that. So what is a pet food allergy? Basically, it's just that. There's two types of reactions that pets can have to a food, and we'll talk about like the different foods that they're actually allergic to in a second. It's a hypersensitivity reaction. So basically, like their immune system hyperreacts to a particle in that food, mainly the protein, and we'll talk about that in a second. Or it's actually like an intolerance, like their gastrointestinal tracts just don't tolerate that food and they can't digest it well. It's a little confusing, the two different types of food allergies, and even more confusing is they can actually look very similar, so they're hard to kind of decipher between the two of them. So I'll kind of dive into like the most common clinical signs that I see with food allergies, and then Marney, I would love to hear what you see with food allergies and what your interpretation is. So believe it or not, pets in general respond to allergies, and not just food. Environmental allergies, pollens, palm trees, all that, flea allergies with itchy skin and skin breakouts, whether that be a bacterial infection or a yeast infection, ear infection. So where we get congestion, upper respiratory infections, we get red eyes, coughing, that's how we present with allergies. They actually get skin disease and itchiness. And it's kind of like a weird concept for people to understand because their pets are itching and they're tearing their hair out, and the number one thing I tell my clients is, okay, we got to figure out what the allergy is. Would you agree, Marney?
Oh yeah, definitely. And it's funny how you say they present with itchy skin, because it's really common. And one of the things that we see, and the way I evaluate animals is to evaluate if they're running cool, warm, or neutral. And really, the dogs with allergies they're not necessarily hot dogs, but they present as looking really hot. So that red inflamed skin, it's itchy, they're licking their paws, they usually lick on the, when the fur gets brown, especially on white dogs, you see that.
From the salivary stain from licking so much,
just licking so much. And you see like the hyperpigmentation. Those are like the dark skin right around the groin area.
Yeah.
Yeah, and their skin's hot. It's reddish and it's hot. And the other thing I really notice is the tongue is usually either bright red or it has like a really super thick layer on it.
Uh-huh.
And their breath usually can send a goat running.
Yeah, so I love that, and I would love to dive a little bit into, like, from an Eastern therapy standpoint, like what you look at and evaluate. So you mentioned the tongue, and I think that's important to have our viewers understand that Eastern therapy kind of looks at the whole pet in maybe a little bit of a different way that a Western medicine veterinarian might look at. And so I'm going to explain what I typically see when I see a pet with food allergies and the most common clinical signs, so my clients can, or people, or viewers can kind of say like, okay, maybe my pet has a food allergy. And then Marney, I would love for you to kind of dive into like looking at the tongue, looking at the whole body, and what you do from an Eastern therapy standpoint. When I see pets, there's a few things that are really like stand out for me with pets who have food allergies. We see a lot of chronic ear infections are a big one that we see with pets that have food allergies. We see perianal inflammation is a big one that we see with pets that have food allergies, and those are probably my top two. But then it's kind of general, and that's why I said it gets a little confusing, because it can present like other allergies, just skin infection everywhere on the body, itchy skin. I think a big thing for me that's kind of helps me kind of decide between whether this might be a pet food allergy or an environmental allergy is, one, like where the pet is itching. So like I said, perianal and ear infections are a big one for food, but also young puppies. If I have puppies that come in and are super itchy and uncomfortable from like just a young puppy stage, I automatically go for a possible food allergy, because generally speaking, when dogs have environmental allergies, which is a hypersensitivity reaction, it takes a year or so to actually become hyper responsive to those allergens. The immune system has to be exposed to it, and then they become hyperimmune to it. So hyper responsive to it. So and that's not necessarily the case with dogs that have food allergies or food intolerance. And so that's a really, really big one for me, is when I see a puppy that comes in with really itchy skin or chronic ear infections, I automatically think possible food and talk about treatment. What do you see, Marney?
Well, first off, I just have 2 points to make based on what you just said that I wanted to kind of go into. So just for everybody that's listening, if you don't know what a perianal inflammation is, it's like a puppy butt, and that's it. It's just a puppy butt. And they're usually red and gross, and it's very noticeable. So I completely agree with you. The one thing I will say that when I see people come in and they're thinking that their dog has allergies and they have this really itchy skin, I do ask about what they've got going on in their house, and especially with puppies, if they haven't converted to like not use the sprinkle on their carpet, or if they spray Febreze, or if they have chemicals on their property and in the yard. I do always ask about that, because I do have to say I think that does that mimics the food allergies and presents as really
like a contact allergy.
Like a contact, exactly, like a contact allergy to something that's just inflaming the skin. So I do always ask about that, but otherwise, yeah, I mean, we see the same exact things, and the things that I will look at maybe just a little differently to kind of decide whether it's an internal inflammation that kind of has that sets the body off balance and creates heat that's internal and kind of inflamed, is checking out those ears. So I will always look and see if the ears are red, if they're warmer to the touch, if they have, usually it's like a brown goop as opposed to just like just dirt. And then I can usually smell almost like a yeasty smell. It's like sweet and sour at the same time, and it smells kind of funky. I mean, it smells like you just mixed up some bread and
it's
saffron.
Funny. We joke with people that work in the veterinary field with animals, like we can like smell diagnoses.
Well, totally.
Right?
Yeah. I smell skin. I mean, and yeah, the skin might smell a little yeasty, or the skin
Mhm.
might be a little like oily and glandular
Right.
um, seeming. But yeah, that tongue. So the tongue in Chinese medicine is your clue to what's going on, because dogs aren't going to tell you um, anything really if they can help
Right.
it. So if they'll let you look at their tongue, and if in general the tongue is pretty red, or has a really thick layer and that layer's yellowish, then usually that does indicate that there's a heat reaction, whether the dog just runs hot, like um, a whatever a Labrador that's just that Labrador that's always wagging, always excited, with bright red eyes, and his tongue is always hanging out of his mouth. That dog probably just runs hot.
That we can't hold because he's all bouncing all over the place.
Exactly. That dog is just a warm dog and could use food anyway. But that dog that in general is awesome in the winter time and is a great dog and disposition is nice and cool and calm, and then start getting that red skin, and especially seasonally, like if that skin gets red every springtime and they present with allergies and they get itchy skin and they get diarrhea often and it's darker than usual, then those are indications that that dog is running hotter than normal and is off balance, and we can do things to bring them back to balance and bring them back to that midline, which is what we're aiming for.
And actually, that's like a good point, because it, again, like environmental allergies, food allergies can really present so similar, and it's very hard to distinguish. But if you do have a pet that is showing seasonal reactions, so when the springtime comes up, that's when they get inflamed and red and irritated, that is more likely going to be an environmental allergy than a food allergy. Food allergies are year-round because they're responding to the food. So the food allergies are going to be consistent as long as you're feeding that pet consistently that diet. And I think it's a really important point about food allergies is to discuss, like, well, what is actually the pet's allergic to, or what are their immune systems responding to? And it's actually the protein. There's a big misconception. A lot of people, a lot of stuff out there about grains, and we'll go into that in a second, but it's actually the proteins that are the most common allergen that pets respond to when they have a food allergy. The top two, and this is important, everyone remember this, chicken and beef are my top two, not my dog and cat's top two allergens or proteins in that they're allergic to in food allergies, which is really important to note because that is most of the dog food and the cat food. I mean, now we're becoming more specialized, which is awesome. But those are what the pets are most allergic to, is chicken and beef. And then third to that would be dairy products. So is that what you're seeing, Marnie? Like, that you're steer away from those type of proteins?
Well, absolutely. And I think that, I mean, my hypothesis on the whole thing is that, you see more reactions to the animals that have been more adulterated. So we've messed with our cattle, we've messed with our chicken, and historically we've used the cheapest, most economically feasible parts of those really adulterated animals to make our pet food. So just created a sludge of problems.
That the body reacts poorly to.
And then added, like tomato pumice to the recipe in order to create more of like a salty, rich flavor. But tomatoes cause inflammation. So you have this, super allergenic chicken, meal or whatever that you've put into the food, which is a hot protein. And then you've added tomato pumice as well, which isn't hot, but is inflammatory. And so it just creates all these issues. And even if the dog wasn't allergic to it before, it totally exacerbate it and create an allergy or sensitivity, which if you eat more and more, you can, rather than desensitize yourself, you can sensitize yourself and cause more issues. I mean, do you see the same thing? I mean, do you see dogs with processed foods just not.
Absolutely. I mean, I think it's the same with us humans. Is like you're going to become more reactive. Your body's going to respond poorly to processed artificial additives. Maybe not the best quality meats. So yes, I think that is all factors that play into it. We got a great question here. Are beef and chicken the most common allergies because that's the most commonly fed? I don't think we have an answer for that, but I'm going to hypothesize that probably because that's what we've been feeding our pets for years and years. And when we started realizing that, they have food allergies, and is when the pet product companies started moving towards, novel proteins like fish-based proteins and rabbit, venison, duck,
yeah.
But that I don't think that existed, 50 years ago. So I don't think we have a concrete data-based evidence to suggest that beef and chicken are the top 2 allergies because that's the most commonly fed to our pets. But I would have to hypothesize that is probably true. And I also think that you're absolutely right, Marnie, that the way these proteins are raised, or these animals are raised, the way it's processed, the way it's created and placed into a kibble based diet is all plays factors in that. So yeah, I think that's all part of the big equation here. So a lot of my clients, so when they come in for pet, and if you guys are just tuning in, I'm Dr. Alison. I'm a small animal veterinarian in Fort Lauderdale, and this is Marney.
Hi, I'm Marney Prince. I'm from Telluride, Colorado, and I own Side by Side Pet Company. We make holistic pet food, and I'm our nutrition specialist.
And she's the best. And today we're talking about pet food allergies, because we commonly see it, and it's something that we diagnose and treat all the time. And so we just it's a little bit confusing of a topic, so we wanted to just give our viewers some insight into how we perceive food allergies. So a big question when I see a client and a patient and I suspect a food allergy, of course, the first question they ask me is, so how do I diagnose this? Like, how do we know that this is a pet food allergy? Again, a little confusing. So of course you go up based on your, the professional opinion of your veterinarian, based upon clinical signs and everything, history and everything else. Allergies are a little tough. It's a rough, rocky road we go down within the veterinary world, and food in general. So there is serum, just like in humans, serum blood testing for certain allergens. But I will tell you, in my experience in going to nutrition courses and dermatology courses, is that the blood serum results for food allergies, not necessarily environmental allergies, but food in specific, is not very accurate. It's not the best way to assess if a pet is truly allergic to that food. I like serum blood testing for environmental allergies like pollens and palm trees and everything that's in our environment, carpet fibers and like cleaners, like you were saying. I think the serum blood testing is more accurate. But with food allergies, I don't trust it 100%. So what I do when I'm trying to diagnose a pet with a food allergy is I place them on what we call the food trial. So we basically slowly get rid of every single thing that they were eating, all treats. And Marnie, if you have a different idea, you can certainly jump in. We're doing a test, basically, a food trial. So we take away kind of any treats that they might have been having, their prior food that might have been chicken or whatever based, and we wean them onto a novel protein-based diet. And when I say novel protein, that is a protein that their bodies have probably never been exposed to. So we talked earlier about like venison and rabbit and duck and salmon and kind of these weird proteins. I mean, not weird, but you know what I mean. And we try to switch them onto one of those base diets. For at least, and this is the big thing that's a hiccup for a lot of my clients and difficult, it's not easy to do a food trial, for 6 to 8 weeks to see if we're truly going to see that response and that change in the pet's skin and ears and clinical signs, basically. I tell my clients that I'm like, think of this as a test. We are testing to see if your pet is going to respond to this new diet. So it's super important to cut out everything else because we're testing them. And then after that 6 to 8 weeks, and maybe we see a great response and their ears are clearing up, their skin looks better, they feel better, they look better, we do introductions of like new things to see how they respond to it. So that's kind of how I diagnose a food allergy. I put them on a food trial. It's very tough for my clients. They hate it. I tell them, let's go ahead.
No, it is. It's so hard for people. Yeah. I mean, you can't feed any table scraps. You can't have any extra treats that you've always given in your pocket. You can't do anything, and yet it's so important. So I'm right there with you. I mean, that's exactly what I recommend. I usually with the dogs that are presenting with these food allergies, we try to go to a cooling diet, so to be less responsive and be less inflammatory. And I will recommend doing do frozen food and thawing it at the meals, and then use the freeze-dried formula as snacks and break it into little pieces so that you're always on the same thing. But it is so important to do, and just to reiterate, that 6 to 8 weeks. So basically, the body's shedding all of those toxins for the first 3 weeks, and you're going to see the same sensitivities and issues, and your dog's still going to present for 3 weeks after you get off that food with all of those same allergies. And then you can see if it's going to start working. So then you need another 3 weeks to really actually see if this new food is good.
It's going to be helpful. And you're basically you have to get that allergen and that immune response out of their body. So
I have a lot of people that are like, well, it's been 2 weeks and I don't see anything, so I'm gonna start introducing stuff on my own. And I'm it's so hard for people. It's so hard to recommend because it's hard to do. I mean, it's just hard to do.
Yeah, so, it's difficult. And so I always tell my clients, like, if we're gonna make the commitment, we're gonna make the commitment. And I think that I actually had a question coming in saying, what are your recommended treats to give your food allergic dogs and cats? So that's the perfect, one of our viewers is asking what treats, and that's a lot of times the biggest challenge is my clients want to give their pets treats because food is love. For that first trial period, 6 to 8 weeks, we try to incorporate what we're trying to feed them and turn it into a treat. And I love your freeze-dried idea along with the frozen, because you can kind of incorporate the two different textures and foods for a treat. But I usually tell my clients no treats, or if there's like a wet formula or something, like just pretend that's a treat. Try to get your dog or cat like loving that as a treat. But for that test period of 6 to 8 weeks, nothing. It's pretty extreme. Even like heartworm preventions that are beef flavored, you have to stop. So it's not like it's a very strict, but by far and away the most efficient and best way to test for pet food allergies. We actually had another question here. Have you had an increase in clients bringing in home allergy tests to you? I've heard these are not reliable. I actually do not. I'm not familiar with these home allergy tests. I don't know much about them, and I don't have a lot of clients bringing them in, but I'm gonna venture to guess that they're probably not reliable.
I know a lot of people that have done them haven't really brought me a whole lot to take a look at. I've looked at a lot of blood serum testing. And that is, Dr. Jean Dodds did just recently come out with a new, I think it's called PET scan. And I'm sorry that I should have looked this up before our interview today, but it's a saliva test. And she's quite a brilliant and reputable veterinarian who I highly respect. And I would venture to say if you want to do something at home and find out that would be the route I would look into. I know it's like $300, so I have to look it up because I'm not familiar with it. I'm going to a vet conference next month, so maybe I'll ask somebody if they're talking about it. I would, and maybe we can do a Facebook Live about it once you learn a little bit about it.
I
recently read a book, Nutrigenomics, and they talk a little bit about it in there. I haven't done much research. I just haven't.
We'll look into it, but I mean, any help in the pet allergy world is beneficial. But yeah, I mean, so I think overall, like that's a really, just to kind of hit home on our main points about food allergies. Um, a lot of clinical signs are ear infections, inflammation around the anus area, itchy butt. That's a big sign. And if young dogs are presenting, like puppies are presenting with itchy skin, like that's a big sign. They're allergic to the proteins in the food most of the time, the protein product. There's a big thing out there about grains and people. It's interesting. I put a poll on our blog about are grains. I asked the viewers, are grains one of the most common allergies that pets are allergic to? And 99% of them said yes. And I thought that was really interesting because it's actually, no, it's not. And that was like a kind of a trend that went rampant through the pet food industry with these grain-free diets, with the idea that pets are allergic to grains, and they're actually not. Every now and then we have a rare case of grain allergy, but it's very rare. And so it's actually the protein, chicken and beef, and then third to that would be dairy. Food trial for 6 to 8 weeks. Oh, go ahead.
That being said, as far as the grains, though, and I do believe in feeding grains and feed grains all over the place, but that being said, there are a lot of grains, and especially the grains that go into the processing for kibble, and especially lower grade kibble, that have so many chemicals in it that's what your dog is responding adversely to, not the actual food product, but what that food product was grown in and how it's been grown.
Oh, sure. And I think that absolutely. And I think when you're using grains as fillers and they're not processed correctly and they're, the cheapest kind you can get, your body, it's just like us. Like your body's not going to respond well if you're living off of fast food your whole entire life and processed food. And I think there's amazing grains out there that are so high in nutrition and so healthy for pets that there's a nice balance between them. And then just making sure that, you put them, you're strict about that diet. I can't tell you, that's my biggest challenge with my clients. They come in and we spend a lot of money on some expensive food and they're like, but I just had to give them a piece of my hamburger last night because they were begging. And I'm like, well, then we have to start all over again.
Yep, absolutely. Yeah, I feel you on that one. I mean, and in the same respect on the other side of it, I feel the clients, because it is fun to feed. I mean, we love with our, I love every day food. I mean, that's kind of what I do. And so it's really hard to be strict about it, but there are some options. I mean, so, making meatballs and treating out of the same food, if you're using a dry food, reconstituting it, putting some, putting it into meatballs. Yeah. You can make bone broth from the same protein that you're using. Like if you've chosen a duck diet because it's a novel protein and duck's really cooling and really inflammatory, then if you made a little duck bone broth and then made it into ice cubes, you could treat your dog with that. So there are some options, and we can totally share them with you guys if you're interested in them. But yeah, keeping that food trial going and doing it for 6 to 8 weeks. And then keep in mind after that, that one is so important. Yeah. Yeah, and like after that 2-month time period, we'll introduce some new treats and different things and watch our pets respond. So it's only for 2 months. But I kind of would love to conclude. I will tell you, as a veterinarian, I see pet food allergies all the time, and I have been prescribing the side-by-side food, which is whole food nutrition, comes from the highest quality. There's no artificial additives, nothing in it. It's purely what it is. It's very clean eating and balanced and whole. And I've been regularly prescribing the Harvest, which is the novel proteins. And I just wanted Marney to kind of conclude with this. I'm seeing great results. And I love that it's not just the protein that we're focusing on. It's also other ingredients in the food that helps with, like you said, like
cooling the pets down, like inflammation, redness, irritation. And Marnie uses her Eastern therapy specialty to kind of also incorporate other ingredients there that doesn't just, you know, treat the protein that we're allergic to. It treats the whole pet. So I would love Marnie to conclude on that, and then we'll say we hope everyone learned something today, and we'll say goodbye.
Well, thanks. I do appreciate you recommending our food, and the Harvest food is a great one, and the one I usually go to for dogs with allergies. It is a pork and rabbit diet, so pork is neutral but very calming to the disposition, and rabbit is a super cooling protein and very, very bioavailable and high in moisture for dogs. So we love that. In that respect, we do take the whole rabbit and grind it up, so you're getting all the bones, you're getting really the benefit of a whole food diet in the best way possible. I don't have grains in this diet just to keep everything moving really quickly and smoothly through. There's ingredients like celery and parsley and chia seeds and pumpkin seeds that all are conducive to not only cooling the body, moisturizing the body, sunning the body, at rebalancing, giving nutrients to really promote a healthy immune system, because really that's the key. I mean, we wouldn't have so many adverse reactions in general if we had a really great immune system. So jumping that immune system up, getting away from processed foods, getting the belly balanced, having some good probiotics on board while you're doing this transition is really important, and you end up seeing great results. The body, where it's felt really inflamed and really hot on the inside due to these reactions that keep on happening, is now cooled and moisturized and can heal. So that's the whole, goal.
I love it. I mean, clean eating and using ingredients that help the whole body, not just like, the specific ailment, and just treating from the inside out. And I'm such a fan, and I'm telling you, at my animal hospital, we're having such a good reaction, good response with that Harvest diet, with pet food allergies. So anyway, we just want to thank everyone for tuning in. I hope you learned a lot. I think pet food allergies is such a confusing kind of misconception kind of topic. So I really do hope everyone learned a lot.
Me too. Thanks so much, you guys.
Bye, guys. Have a good day.
Bye.